Hi everybody, thank you so much for joining us once again. This is Candid on Candid Chats, all things wellness. I'm sitting down with Jaime Doise today and we are here in the Woodlands, Texas. She is an independent consultant at Body Benefits in the Woodlands, and I'm going to allow Jaime now to take over and explain to you exactly what her title is and what it is that she does here.
Thank you so much for having me. I appreciate it. I'm Jaime. I am a bioenergetic clinical consultant. I'm also a certified practitioner in energy medicine, and I do own my own business, Energetics Holistic Wellness. So I am not only a practitioner, but I also am a clinical consultant. So I help doctors implement this particular bioenergetic assessments in their office and train and coach them. I have clients all over the world. So I've been doing this for probably 9 years now.
That's awesome.
I've been in the medical industry for about 25. Always had a passion in healing people, alternative health, and this was kind of just a fit for me 9 years ago when it came across my path. So very fortunate.
So you are here and you're basically a person who is here to connect the dots for people, right? So you're here to find the root causes of any conditions that they may be experiencing. So if you guys are watching and you're stumped and you're at a place where you're having sort of a medical mystery right now, right? And you know your symptoms and you've been to several doctors maybe and you're just kind of at a loss. You don't really know what it is that's going on emotionally, physically, spiritually, energetically in your body. Jaime is somebody who can actually help you to peel back the layers and uncover what it is that's going on, right?
That's correct.
Okay,
Yeah.
So if somebody is watching right now and they're curious about what it would look like if they would come in to see you, you can give us a rundown of like what, they're going to come in for a consult, perhaps, and then what's going to happen.
Yes, so typically we'll do a bioenergetic assessment. We take a look at the history of the body. We're not able to diagnose, treat, prevent, cure any diseases like this. This is strictly an alternative bioenergetic, but we do get to the root causes of the problems. And so what the assessment entails is looking at the energy distortions in your body field. We can also look at organ shock and trauma, nutritional and environmental deficiencies. But the system does a really good job at looking at the brain holograms. What emotional shock conflicts correlate and compromise certain organs. And so typically it's a missing piece in healthcare where it kind of just bridges the gap between Western medicine and Eastern medicine. It's a mix between quantum physics. Everything that we do is energy.
Yes.
And so when we can actually identify exactly what information the body is asking for, then we can re-imprint that into the body field by using the correct frequency, vibrations. It's just it's a mesh between Western medicine and Eastern medicine.
So when we speak about energy, that's everything around us. So you walk into a room and you feel uneasy, you may be picking up on something. You've gone through certain things in your life and you've carried that energy with you throughout your life. That resonates with your body, with your spirit. It can entrap itself in your body and cause physical pain and distortion, disease, things like that. So basically what Jaime is speaking about is that the way they heal your body is through balancing your vibration and your energy, correct?
So each organ functions on a specific frequency, and so when we test the body, we're actually getting a measurement. So think of it as an EKG. When you go to an EKG, it's measuring the algorithms of the heart. We're doing that with our entire body field, and so what we're doing is actually measuring twice in the body. We're testing to see where that organ is functioning on a frequency level, and then we're going to imprint and put the correct frequency in the body. So your body is basically functioning like a guitar or an instrument, and we have to harmonize it. If a guitar is not working properly, what happens?
It's out of tune.
Out of tune, it sounds terrible. Our bodies work the same way, and so when we can identify where the organ is functioning on that frequency, put the correct frequency back into the body field, the body does have an innate ability to correct itself. So we're looking at many different facets, peeling the layers back, so to speak. Emotional components, we do incorporate German New Medicine, which initially I thought, wow, this doesn't even resonate, or how does this work? And when you can pinpoint in the brain hologram specific emotions that compromise organs, and then you start to correct it by putting correct frequency in, you give the correct affirmation, the body just does a 180, and it can't go anywhere else but heal. And so the body feels better. When we function on a high frequency, we're positive.
Right.
When our body fields are low and just completely depleted, we function on a low frequency, and that brings in depression, anxiety, sleep disorders, it just, you name it.
Yeah. Everything that just, whenever you feel like you just want to sit on the sofa and do nothing all day, you're at a low vibration.
Correct.
Right? When you wake up and you're energized and you're ready to go and you're feeling full of life, something has resonated in your body that is giving you that fulfillment and that energy.
Right.
Yeah. So obviously being in depression, anxiety is not somewhere that anyone wants to be. Yeah. So whenever they come in and they have a scan done, does it give them a picture of what's going on with all of the organs of the body?
It does. So there's many different layers to this. We do a voice analysis that actually measures the vocal cords in the body.
Interesting.
And it's going to give us a range of prioritizing what organ needs to be looked at in more detail. And so again, your body is an onion, and we're just peeling the layers back, so to speak. So that is the first phase of what we do. We measure it for 20 seconds, and then it sends the client an MP3 downloadable version of the correct frequency. So it sounds like spa music, but it really is just the tune vibrations.
Interesting.
Then from there, we do a vital scan, which identifies 25 pages of allergies, specific molds, bacteria, viruses, funguses. We look at organ function. We can also look at some emotional disturbances as well. How the body is responding to aggravants such as different food sensitivities. Because when you look at food sensitivities, most think, oh, well, my digestion system doesn't have any symptoms for that.
Right.
Well, that doesn't necessarily mean you don't have a sensitivity. It doesn't have to be an allergy, but certain things can trigger and aggravate certain symptoms and organs where you can actually, it can cause inflammation in the body, or it can cause the organ not to function, and we can actually identify where the body field is going to be in a vibrational.
Right. So most of these emotional responses that our body has, like Jamie said, it's not always going to be a stomach ache or a gut issue that you're going to automatically resonate with. It can be any kind of inflammatory response in the body. You could get psoriasis, eczema, hives. It could be responding through symptoms in your skin, your scalp.
And you bring up a good point when you talk about psoriasis and skin conditions. Typically when we look at that, we're looking at boundaries. And so when we get into an active phase, we may have periods where it's just a vicious cycle where sometimes it's okay, sometimes it's flared up. But when you look at skin in general, we're looking at boundaries. So are you creating healthy boundaries with others? And start to be cognitive and conscious of what's happening at that time, because when you can pinpoint some of these things from a subconscious to a conscious level, then the body has an innate ability to also correct itself.
Layers is very important, right? Because this is, whenever you start to have symptoms, it may not be something that's going on at this moment in your life. It may be something that's been piling up from childhood trauma or teenage years, etc. So that's why the scan is so important, because we may not be able to see past what's going on in this moment in our life, but it can really show you what has been piling up inside of your body through all the years and what needs to be healed.
Right, and sometimes it goes back to generational traumas and things that we don't even recall. When you talk about hereditary conditions such as high blood pressure, and everyone says, oh, it's in my family, it runs down the line. What we're looking at is what emotional disturbance has been passed down generation after generation.
I think a lot of people also, they grow up in certain situations and that's their norm.
Exactly.
Right. So you live in a stressful environment, or that's just normal to you. You had an alcoholic father, so having an alcoholic husband is just your cross to bear, is what you feel. It's what you do, but it doesn't have to be that way. And in understanding what you've carried with you from childhood into adulthood and what it's done to your body is a gift. It really is a gift, and I think this scan is a gift. So even if you're not itching right now, or you're not seeking help for a medical mystery, I think the scan can just open a present for you to understand what's going on with all of your organs, and all the way down to a cellular level, correct?
Right, because typically we can't see energy,
Yeah.
and so people don't really resonate with how is this incorporated into my health. When you do the scan, you can actually see the blockages, and you can actually see everything in black and white and three-dimensional. It just really changes the mindset of and it's a game changer, because it's actually the puzzle piece and the missing piece in healthcare. And so I have several doctors that I consult with that sometimes they'll call me and they'll say, hey, I'm just stumped. I don't know what else to do. I've ran all these tests and nothing comes back, and you know, my patient is still having symptoms. And I always ask, have you looked into the emotional component? First of all, sometimes they're not trained or geared to do that. That may not be their specialty, so they're not really amped to really looking at the German new medicine aspect to this. And so this is where I can kind of bridge the gap with these physicians and say, let me do a bioenergetic assessment. This is not to take away what you're currently doing. This is a valuable tool that will give you more information about your patient, that you can make a better assessment. We have better outcomes, and it's a marriage between Western medicine and Eastern medicine, because they're not used to doing these types of things. But they're realizing now that we're missing a big piece in healthcare. They're getting dinged for not keeping that patient well. How many medications are they on? And so we're here to be their friend. We're not here to, you know, put them out of business or anything like that. Even in mental health, this works really, really well, because we can see so many layers of the emotional components. Mental health counselors always will call me too, because you always rely on what the patient is telling you, and sometimes they don't tell you everything.
Because it's their normal, I think. They don't see it as a problem. And a lot of us are stuffers. So we stuff, right? We stuff until it explodes.
Exactly. So they, you know, always say, my patient or client doesn't always tell me everything, and here's where the scan comes into play, because the scan will pick up exactly what the body field needs to correct at that given moment.
What are some of the conditions that people have come to you with that you've had success in helping with?
I've seen an array of, you know, relative people that want to stay healthy, all the way down to traumatic brain injuries. I've assessed people with autism and on the spectrum, addictions. This works really, really well with addictive behaviors. You name it, we have a niche for it, and again, it's to complement Western medicine.
And I think most addiction absolutely stems from emotional trauma.
Absolutely.
You know, anything that we're addicted to, we're trying to not feel something. We're trying to suppress it. So it's getting suppressed in our bodies. And causing these symptoms. And
it's energy. And so when you look at your body, imagine your body like a faucet. And when that faucet is clogged, what happens? The water doesn't come out. And our bodies work and function the same way, where we have to physically go in, identify where the clog is, unblock it, and then move forward through it. And so that is what these assessments are for. It's useful information, so you can get a better understanding of what am I trying to accomplish with my health, and what are the blockages that are keeping me stuck of where I am.
Yes, stagnation is the cause of disease.
Absolutely.
They always say we're the authors of our own disease.
We are.
And we don't even know what we're writing sometimes, right? So what exactly is it that you guys give to patients to help them in their healing process?
So first we identify where those distortions of energy are. Then we unblock them by using a pulsated electromagnetic frequency. There's no contraindicators to medications, which this is really good. So a patient or a client can take current medications, homeopathies. It's not going to contraindicate any of those things. It's strictly using the body's own energy fields. We unblock it with the PEMF, the pulsated electromagnetic frequency, and then we're going to re-imprint with infoceuticals. So most doctors prescribe pharmaceuticals. We're giving information. So the assessment will give you the correct information of what your body needs to be re-imprinted with. What this is it's not chemicals. It's strictly infused into structured water, and it's corrected frequency. So like I said earlier, your organ functions on specific frequencies. We're going to identify what frequency your body is needing and then give you this tincture to take home.
Okay. And the scanner, is that what it's called? I'm sorry, say it again.
So this is a PEMF device,
okay,
which unblocks the distortions of energy.
Okay. And you said there were no contraindications to certain things, but is this okay if someone has a pacemaker or anything electrical in their body?
So we typically will avoid the area of a pacemaker,
okay,
just to stay on the safe side. It's not going to contraindicate that, but we don't want to take on that risk.
Right.
So typically treating just away from the vicinity of the heart is appropriate.
Okay.
Just not directly on the pacemaker.
And the scan that you use is on a computer module, and what exactly? Are we scanning the hand, or is we being scanned with this?
So we do both. So we do the voice analysis first,
okay,
and then we have the hand cradle, and then the next piece would be the transducer. So it's going to pick up the energy and the brain waves from the left side of the brain, and then function to the right side of the brain. And so we're able to measure, just like an EKG, just like an MRI. It's measuring something. So like I said, it's a mix between quantum physics, Western medicine, biology. We're getting beyond the biochemistry of the system.
Okay. Is there anything else that you want everyone to know about when they come in to see you, or what it is that they can actually come in for? So if you guys are watching and you think that maybe you have an issue that can't be solved, there's really nothing, right?
Right.
Pretty much anything, they can come in here with anything.
They can. We usually keep you in a very relaxed environment. It's non-invasive, so basically there's no pain involved. Typically I'll have some release responses within that first session, especially the emotional response and the emotional release. A lot of my patients will better just after their first session. However, the more chronic the condition, it may take more time. And so we set expectations, give your body time to heal, especially if there's been a lot of trauma and certain things like that.
And do you think that the emotional release that they may experience is probably just because you're bringing awareness to the issue? They're coming in here so lost and confused, and then after the scan, it's making them conscious of what's truly going on in their body.
Right.
And that in itself could relieve so much pressure off of a person. Just having ailments that no one can explain to you would cause depression and anxiety, I think, in a lot of people.
Right, because when we look at the emotional shock conflicts, it's also causing a correlation between the energy distortion. And so when we can identify exactly where in the body feels that energy distorted, we're going right to unblocking it. So we're opening up that channel, so we're allowing for the new information to take its course, and then the emotional stuff seems to clear. When we're dealing, for example, back injuries or back pain or anything like that, we look at, where's the back hurting? And a lot of times it's dealing with emotional stuff. The neck is more of like morals and values. The mid-back is dealing with financial burdens and being overwhelmed and certain things like that. And so when we can pinpoint and bring awareness to that particular area, and we release that blockage of energy, then the body can function like it's supposed to.
Right. So we're going to post this on a Monday, and I'm hoping that people will actually join in to the Watch Party feed, and you'll be able to maybe answer questions that they may have.
Absolutely.
Okay.
It's very accurate. It's very intriguing. It's jaw-dropping to see, wow, how does placing my hand on a scanner or, measuring my vocal cords, how is that resonating with my body field? And I always say, I know it may sound quackery, but until you get your own bioenergetic assessment done, that's where the game changes, because you can actually see not only the accuracy of it, but the efficacy of it.
Yeah. I think the most important thing for those of you watching to understand is the reason this is so effective and it works is because it works on such a cellular and energetic level. And it's not just you walking into an office and saying, my head hurts, or, my jaw hurts, and then a doctor is going to check just around those areas, right? So if they can't find something physically wrong with you, then that's where they get stuck.
Correct.
So if if you're experiencing something like that and you're just stuck, it's probably most likely some sort of emotional trauma. So getting to the root cause and maybe understanding, when did this start to happen? When did I start to get these migraines? When did I start to get these kidney issues or these gallbladder issues, or this chest pain? It can kind of bring you back to the root cause of what's getting you all of these symptoms. And then whenever Jamie's going to come in and do this scan, it's just really all going to make sense to you.
Right. It's a puzzle piece.
Yes.
And it's like, wow, I finally uncovered and unraveled the missing piece to my health.
Yeah.
And for me, I had mysterious health issues as well, and kept going to doctors. And at first, I was on a kidney transplant list.
Wow.
And knew that, yes, you have, focal segmental glomerulosclerosis, and it's autoimmune and it's idiopathic.
Yeah.
And I'm like, well, why do I have this? And they could never pinpoint why I had it. And so over the years, going through advanced trainings and really embracing where those emotional disconnects were, even if I didn't consciously think about these things, they were sitting in my body field, even from, childhood stuff or, generational stuff. And so when I was able to really identify and put my hands around it, my health started to improve. And it was just a God divine intervention how I became connected with this type of information, and very grateful that I did bring this on.
I think that's the most important part of the story, is that it was your experience that brought
Personal,
you here to a place where you want to help others to heal with what helped you heal. Autoimmune is something you just brought up, and I would like to speak on that with you for a minute, just because a lot of people I deal with as a massage therapist and who come through our office for sleep apnea and other things like that are experiencing fibromyalgia, lupus, a lot of autoimmune diseases. Can you speak on maybe the roots of what causes this inflammation?
Right. So when we look at autoimmune, we're looking at the immune system. When we look at it from a creative cycle and a life journey, emotional component, the immune system is dealing with security. And so if someone is insecure in whatever aspect of their life, then it manifests into the physical over time. And sometimes it's just pinpointing what it is, even if they don't recall. And when we start to put the correct frequency in, things over time start to make more sense. Each session becomes just more clear. And, I'll have people that are just pain-free after 3 or 4 sessions when they've been doctor shopping and taking medication after medication for several years with no results.
Yeah.
Correct.
Is there any other condition that you see very regularly?
A lot of stress.
A lot of stress.
We deal with stress. Those that may be on 2 or 3 blood pressure medications.
Wow. Yes.
We're able to. I don't, tend to take them off of their medications, but I work very closely with doctors.
Yeah.
But when we can identify what those stressors and aggravants are in the body field, it can be something as, what foods are you eating that are causing inflammation in the body. And so we can just take a snapshot of many, many different facets in the body field and address those, identify them, and then overcome them with many different things. And, a lot of people will take supplements, and I'm not knocking supplements by any means.
Right.
However, what may be good for me may be terrible for you.
And also, if your gut is not healed or you have a leaky gut, you're not going to be absorbing your nutrients from your supplements
and
anyways.
The gut causes and holds a lot of emotional stuff where we can't digest emotions.
Yes.
And so when you can't digest emotions, it causes semi-trucks to back up, and your body, because it's centrally in the core, it can't function like it should, and so everything just gets clogged and backed up, and then your adrenals start to tank, and it's a snowball effect.
We talk a lot about this on my show, like people having constipation, because the gut is so messed up, and people don't even realize that you are supposed to use the restroom several times a day, and you have people walking around not going but once every 6 or 7 days, and that is not normal at all. That is definitely stagnation in the body. That's going to cause a lot of symptoms and illness. So you really have to figure out what is actually causing you to not process your food properly and digest properly.
Right, and a lot of times I'll see it's as simple as the energy is distorted in the body field. When we deal with constipation, specifically, it's letting go. What are you
You're
not letting
holding
go? You're
on.
holding on
Yeah.
to stress and emotions that just need to be let go out of the body. And
Yes.
so when you can identify where these things are, then the body starts to work like it should.
Yeah.
And sometimes taking, 20 different supplements, the body can't process things. If your body's not absorbing the nutrients from natural foods and you keep overloading it
Yeah.
with different supplements, then you're still less is more sometimes.
Yeah, and a lot of supplements aren't just an herb. They have a lot of chemical components to
Correct.
them that your body may not tolerate that.
Correct.
Yeah.
And they do have its place at the right time with the
Right.
right provider.
Yeah. So if any of this resonates with you guys, you can go to Jamie's website. You want to give them your website, Jamie?
Yes, so if you go to Energetics, INNERGETIX, holisticwellness.com, there's a list of different features and services, and I have a video listed on the website that you can get a little bit more understanding
Okay.
of how this works, how important energy is in the body, and just some more information. You can schedule an appointment.
On the website?
On the website. You can call me directly. I do offer services here in the Woodlands. Obviously, Body Benefits is a place that I consult in, but I can accommodate clients and practitioners out of state.
And you're from Louisiana?
I am from Louisiana.
She's from Louisiana
Go
too.
Tigers.
And you do come to Louisiana?
I do.
Times
So
to do
I am in
consultations?
Louisiana at least 2 or 3 times a month, different clinics. I can give you more information on that. Contact me directly. My cell phone, you can always call, text me.
Okay.
I'm always available.
Okay. So if you guys want to have a consultation just over the phone, you can call her and do that. If you are in Louisiana, because most of my people watching are just from Texas and Louisiana as of right now, you can maybe set up with Jamie to meet with her the few times that she does come into Louisiana. Is it in the Lafayette area that you normally go to?
Yes,
or?
I go to New Orleans.
Okay.
I come here to Lafayette, Broussard.
Awesome.
And I can also accommodate remote clients too. So I have clients all over the world that
Okay.
I do. I can also talk to doctors and certain things like that, just to kind of bridge the gap.
Right. Okay, to figure out what it is that they're doing with you. And,
Correct.
Okay. Awesome. So if you guys are interested in anything that Jamie has going on, we'll post her website up on the feed as well. We're going to put up a few products that she offers whenever she does the scan. And I'm actually going to get a scan in a little while, so I'm
Yay.
going to probably go
Fun
live
times.
at some point and share my trauma with you. So I'm really looking forward to that. I thank you for offering that to me. That's awesome.
Yeah, thank you for having me. I
No problem.
appreciate it so
I
much.
appreciate it. I definitely think that what she has is a gift to the world and to all of us, and I'm so grateful that I was able to share it with you guys today. So again, we're going to put up all of her information for you to contact her if you are interested in any of her services. And I thank you guys so much for watching me and Jamie today on
Yeah.
Candid Chats, all things wellness. I'll see you guys next time. Bye.